Hello everyone, I'm Anastasia. Welcome back to another session of Fundamental of Nursing. In yesterday's session, we've discussed about what is the definition of nursing, what are the various concepts as well as the objectives. In today's session, we are going to discuss about what are the characteristics, the nature as well as the scope of nursing. So before moving on to the characteristics and to the scope of nursing, we must first know what the definition of nursing is. So here, according to Henderson, nursing is defined as a unique function of a nurse to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would do unaided if he had the necessary strength, will, or knowledge. So here, nursing is simply a profession whereby we will be delivering care to the patient, we will be assisting the patient in their day-to-day life activities, and we will also be helping them in the various treatment modalities in order to improve their health. Here, as a nurse, not only will we be providing care, but we will also be the ones who will be educating the client and the family members about the various factors they should adopt in order to promote their health. Another definition, which was given by Florence Nightingale, states that nursing is the act of utilizing the environment of the patient in which he lived in order to assist him in his recovery. As we all know that the environment also plays a major role in determining the health condition of a patient or of a person or a family as a whole. So here it is very important that we must maintain our environment, a surrounding which we lived in order to promote our health. So being a nurse, what do you think are the various characteristics that one must possess? Here it is the nurses who has to provide care to the patient. Here the nurses will be the ones who will be providing care to the sick and to the injured person. Nurses also involve a close personal contact with the recipient of care. So here, being a nurse, we should try our best to maintain a good rapport, to maintain a good interaction between the nurse and the patient and also with the family members so that we get all the accurate information which is needed. By maintaining a good rapport, by creating an environment in which a person feels comfortable, these people will be able to open up themselves and through this way, it will also help us in planning the treatment regimen for the person. Here, nurses must always take an individual as a human being and not as a diagnosis. So here, nursing is concerned with services that take human into account as physiological, psychological, and as well as sociological organism. So here, a nurse must always treat an individual as a human being and not as a diagnosis, because while treating the patient, we must also keep in mind about the various physiological, psychological, emotional changes that will occur in the particular person. Nursing is also committed to promoting the individual, the family, the society, the community, as well as the national health goals in its best manner possible. So the nurses here will try their best in order to improve the health status of the individual, family, community, and the society. Nursing is also a profession who will be committed to personalized services and who will be providing care to all the people equally, irrespective of their caste, creed, their background, as well as their economic status. Here, nursing is also committed to involvement of the ethical, legal, and political issue whenever they are delivering any healthcare services to the people. So these are the few characteristics of nursing, that is, providing care, maintaining a close personal contact, treating an individual as a human being and not as a diagnosis, trying to promote the health of the individual, family, or community in the best manner possible, and also providing care to all the people equally, irrespective of their caste, creed, as well as the economic status. And the last one is the involvement of ethical, legal, as well as political issues whenever they are delivering any healthcare system to the people. So these are the characteristics of nursing. Next, moving on to nature of nursing practices. So here, as we all know, that nurses are a part of a multidisciplinary team which will be responsible for providing care to the patient. These nurses are individually accountable for their action as well as their practices within a statutory framework. which is established in order to protect the public and also to ensure that there is a quality of nursing services which is being provided to the people. As we all know that the role of the nurse is constantly changing and developing over the years. So here the nurses can also add on new functions. But before they do so, they must make sure that these new functions must benefit the client, and these nurses must also be competent enough for the new role. So now here let's look on what are the various services that a nurse can provide. The first one is to help the individual, the family, or the communities in order to achieve and to maintain good health. How can this be done? This can simply be done by the health education, whereby we will be educating the people about the various preventive measures which they can adopt, and by making various lifestyle modification so that it will improve their health status. The second one is to support, assist, and care for the people when they are ill and also when their health is being threatened. The third one here is to enhance the people ability in order to cope up with their disease condition or with their disability. And the last one here is to ensure as fast as possible that death is dignified and free from pain. So here these are the various services which a nurse can provide. So here the nurses can achieve these goals by applying their skills and the knowledge which they have gained through their educational training, and the ones which are being updated and tested by the research. Here being a nurse is not an easy job because it requires the combination of the professional knowledge as well as the skills. Not only that, the nurses must also have the desire to provide care to the patient so that this nursing care will be effective. The nursing practices also include assisting the health of the people, their health problem, as well as the resources that they have in order to cope up with these problems. After assessing all of these, the nurses will then decide what are the nursing care they can provide in order to help them. And also being a nurse, she can also refer them to other expertise when necessary. As a nurse, she can also plan, provide, and evaluate the programs of the skilled nursing care. Moving on to the scope of nursing. Here, as we all know, that the scope of nursing practice is defined as the range of roles, responsibilities, functions, as well as the activities which a registered nurse are educated and also authorized to perform. So here the scope of nurse is nothing but the various roles, responsibilities, and functions which the registered nurse has the authority to perform. This will also describe why, when, how, where, and why do we need the nursing practice. The broad range of nursing practice here also involves the various roles and activities which is undertaken by the registered nurse in order to address the full range of human experiences and also their response to health as well as illness. This can also include the health protection, promotion, maintenance, restoration, rehabilitation, as well as the palliation. So what are the various settings in which a nurse can work? Here, the first one is the hospital. The hospital is the most common setting where you will find a large number of nurses. Here, nurses will be the ones who will be assisting the client in their day-to-day activities, who will be the ones providing care, and who are also the ones who are responsible for the state of health of the client, and also the one who is responsible for taking the full care of the client. The second one is the nursing home. These nursing homes are the ones which are run by a group of doctors. Here, usually the old people or the ones who are chronically ill will be the ones present here. So what is the role of a nurse here? They are the ones who will be providing constant care and who will also be the one who will be assisting them in their day-to-day activities. The third one here is the clinics and health department. Here, the nurses are the ones who will be assisting the patients with their outpatient services. Here, the outpatient services are usually the healthcare services which is being provided to the patient who don't need to be hospitalized. The next one is the orphanage and old homes. Here, the nurses will be present there in order to assess the health condition of the people and also to provide care if they are suffering from any kinds of condition. The nurses can also work in various military hospitals where they will be providing cares to armies, navies, air force, and also marines. A nurse can also work in a community setting whereby they will be delivering care to the people. They can work as a school nurse or as a health visitor. The next one is the industrial houses and factories. As we all know that in industries there will be a large number of people who will be working, so these people can undergo various accidents or they can suffer from many occupational diseases. So being a nurse, you can provide care to these people who are suffering from these occupational diseases or who have injured themselves in the workplace. You can also work in railways and public sector medical department or in training institutes as educators. Here, as nursing educators, you will be the one who will be also educating the future nurses and helping them develop their skills and knowledge. You can also work in home care, hospice, and palliative care, whereby you will be delivering care to the people who are suffering from critical condition or who are on the last stage of their disease condition. You can also work in public health agencies and deliver many mental health services. You can also work in the private health sector, and you can also be a prison nurse whereby you will be delivering care to the prisoners. And lastly, you can also work as a researcher whereby you will be conducting various researches in order to promote advances in healthcare and health promotion practices. Here, a nurse can choose to work in one permanent setting or may take short-time assignment as a travel nurse in order to fulfill the temporary projects for the nursing staff internationally. They can even serve in government and elected position whereby they can work as a nurse practitioner, clinical nurse practices, nurse educator, nurse researcher, or as a manager. So here being a nurse does not require you to only work as a clinical nurse, but you can also aim for various other positions such as a nurse educator, nurse practitioner, nurse researcher, nurse manager, and many more. So here depends on us on what we choose and what we want to work as. So here we've come to the end of this topic, whereby in today's session we have discussed what are the characteristics of the nurse, what is the nature of a nurse, what are the scopes of a nurse, what are the services that a nurse can provide, and the last one are what are the various, and we have also discussed about the various settings in which a nurse can work in. So I hope you guys have got a clear insight of this topic. So I'll be meeting you guys in another session. Thank you.